Okay, well, welcome everyone. I'm so glad that I was able to be connected with Sarah and give you guys a little information on hoarding disorder. I know that it is challenging when you are working with clients that are struggling with these behaviors. And I hope to give you some background information that can kind of explain some of their thought processes and some of their behaviors and help you communicate with them a little bit better. So first I'll start off to let you know that I put more words on these slides than I normally do because this is a staff in service and I know you guys will be sharing the slides. And if someone doesn't see it, I wasn't aware we were going to record. So I was thinking if someone didn't see it, I didn't want to give you a slide with no words on it. That didn't fill in a lot of blanks. So there's more words. So hopefully anybody who looks at the slides should really be able to get the same information that we shared today. So just as an FYI. So I have no conflicts or anything. I have been working with people who struggle with hoarding behaviors for a while, but not in the same capacity that you guys work with them. I don't go into the home. There's not a lot of one-on-one. I do a group workshop, which I'll cover a little bit later in the presentation. But I have experienced a lot. I've spoken with a lot of people, and really the one big message is that each situation is very unique, and that's really important to keep in mind. I will also put a bunch of questions in the chat, and we'll come back to all of them. We should have enough time to get to all the questions. And I really shortened this presentation really just to give you the highlights and really just to cover the things that I think you're most curious about. So the first thing is really, this is a mental health condition. This is not, these are not just unrelated behaviors or behaviors where they're trying to be difficult. This really stems from a mental health condition. And the pure definition is when you have a person who feels a strong need to acquire and save a large number of items, regardless of the monetary value. And that's a key part in the definition. It really doesn't matter if you and I share the same definition of how valuable these items are. They acquire them, they fail to discard them, and all of that acquiring really impairs their daily life, and it can impair their health and safety. And it's really important that underlying emotional and mental health conditions must be addressed in order to achieve any kind of behavior change. And really physical health conditions as well need to be addressed. All of that sort of goes in together. And in order to get good behavior change, you really need to address the whole person. So the most popular question that I get that I wanted to start off with, is it clutter? Is it a collection, or is it hoarding behaviors? So when you're dealing with someone that has hoarding behaviors, this is a lot more than being messy or disorganized or having a lot of stuff, okay? So, which is really how you would describe someone who clutters. They just have a lot of stuff. They might be a little messy. Collectors look for a specific item. They often organize and display their items. They might, put it out. And in general, it's something that we can, whatever they're collecting, it's something that we can all agree has some sort of monetary or sentimental value. So you can think of stamps or coins or comic books, and it can be anything. It can be dolls. I mean, there's a wide variety of things that people can collect. Hoarding behaviors, when you talk to someone who is really struggling with hoarding behaviors, there is clinically significant distress, strong urge to save these items, and persistent difficulty with discarding. So when you start talking to them about getting rid of their items, that's when you can really see the difference between someone who just has a lot of stuff and clutters, or someone who's a collector, versus someone who is really struggling with these behaviors. Really, it comes down to discarding. That's really the key. And to me, the other key is that the amount of possessions that they have, when it interferes with them using a room the way it was intended. There's so much stuff on the bed, they can't sleep on the bed. There's so much stuff on the couch. Maybe they've saved a little space for them to sit, but the rest of the couch is full. Maybe they have stuff all over the kitchen counters. It can be anywhere. There can be stuff in the fridge. There can be stuff on the stove. But ultimately, that key that you can't use the room the way it was intended, that's a really big key to know that you're working with someone who really is struggling with these behaviors. Oh, there we go. So just a little background information. It's estimated anywhere, really, I've seen estimates as low as 2% and as high as 6% in the US. It's about 16 to 20 million people. I actually think it's higher than that. I think these are the numbers that we know about. I think there's a lot of people out there who are struggling with these behaviors that we don't know about. And these rates are pretty consistent with all countries, Germany, France. Canada seems to have a pretty low rate for some reason, but everybody else seems this right about. So it really doesn't have anything to do with the United States having a lot of possessions. This is really a universal problem. The prevalence is similar for men and women, but women more often will seek treatment. And the average age in treatment is around 50. But the average age of onset is adolescence, which a lot of people don't recognize that it starts really early in life. When we first started studying hoarding behaviors back in like the 1990s, they noticed that everybody who they were dealing with was an older adult. So they thought it had something to do with aging originally. But through time and more research and studies, we realized it starts much, much earlier. You start seeing some of the behaviors as early as adolescence. Family history is very common. About 84% will have a first-degree family relative who is also struggling with these behaviors. And it occurs everywhere, all cultures, all income levels, all education levels. I have met with truly successful professional people who outside of their home, you would never know that they are struggling with these behaviors. They, can advance professionally. They're really great, wonderful people. All of them are. I've really enjoyed everyone that I've gotten to know, but all backgrounds are different. Income level doesn't matter. And that's another thing to really understand. So how does it happen? How do they get all these items? Like how does it what happens? So there's a few ways. Compulsive buying, retail, web shopping. Web shopping is huge, particularly now during the pandemic. I think all of us are probably shopping over the web a lot more than we used to. Compulsive acquiring of free things. So think about the last conference that you went to. What did you come home with that you didn't start the day with? You have papers, flyers, all the free giveaways at each table. If you bring all of that home for every conference that you go to and you never get rid of it, you can kind of imagine how things will build. You go to the grocery store, you get flyers on the car, you get all of your, even if you go to different other events, sporting events, outside street events, there's always things that you can come home with and imagine never getting rid of any of it. And of course, we have the extreme cases where we have people dumpster diving for their treasures. And also there's passive acquisition, junk mail. Just think of that. If you never got rid of any of your junk mail, how those piles would add up. Food packaging. A lot of people don't realize, let's say you're going to have a TV dinner one night, there's the package that it comes in, the cardboard box. There's the container that actually holds the food. There's the plastic film that is covered on top of that. If none of that is discarded and it stays, that's really how all these items enter the home. So why does it happen? So there's two primary reasons why people will save things: sentimental and instrumental. So sentimental says, this is a part of me, it represents my life. The difference is it can be a family heirloom, which something maybe all of us recognize would be worth saving, or it can be their daily to-do list. They can save a to-do list from 2 weeks ago because on the to-do list, it said, go to the bank. And at the bank, I met Susan, and I want to remember that that's where I saw Susan last because we had this conversation. I don't want to forget that that happened, so I need to save this to-do list. So there's a logical thought process behind why they're saving things. I got a flyer in the mail for, there's a sale on tires. And I know I don't have the money right now to buy tires, but I want to save this flyer because when I do, this is where I'm going to buy the tires at. So you can see the sort of logical process that comes into play. Instrumental. I say, I could use this. This is something I can use again. Every item has multiple uses, and they're truly very creative people. They mean the words that are coming out of their mouth. They're saving it because they actually intend to use it the way that they think they're going to use it. And they feel it's an opportunity that's lost if they throw it away. So there can be a strong sense of responsibility as well, that they feel that they have to hold on to it because it would be terrible if they didn't do this. So let's say we all know like a kindergarten teacher that does art projects with paper towel rolls, the cardboard in paper towels. So they might save all the paper towel rolls because they know that kindergartners use those for art projects. The difference is that a teacher hasn't asked them to save them. So they're coming up with this idea on their own and they're not following through. They have a plan for the item, but they're not actually doing it. So they're collecting all the cardboard tubes, but nothing's happening with them. And what happens? So clearly we get a lot of piles of stuff that starts happening. What's important to know is in these piles, there are items of mixed importance. So there can be, in the same pile, there can be junk mail, there can be the deed to the house, a marriage license, money, which is why when you're working with somebody who is having these behaviors, you really have to have the time and the patience to go through each thing. The forced cleanouts where they just scoop up a bunch of stuff and throw it out has repeatedly been proven that's just a terrible idea for multiple reasons. But for a really basic reason is you don't know what's in the pile. You know, just because it looks like junk doesn't mean that there's not important stuff mixed in between. Because the people who are saving these items, everything is important. All of it's important. And they can talk to you and give you good reasons why everything's important. So, and another thing that happens is sometimes they'll leave everything out in these piles because they have a fear of putting things away, putting things out of sight, because then they can't see them and they might forget about them. So that can also be a problem. And there's almost always a fear of making a wrong decision. If I put this in this drawer and then I forget where it is, then what's going to happen? If I put stuff in this closet, but then I decide that I need something that was in the back of the closet, how am I going to get to it? And they can go on and on about trying to make the best decision. That what happens is that they don't make any decision. It's just this endless circle of what if, what if, what if, and so no decisions are made. And that's why sometimes it will appear that progress isn't being. So it's really important to know that during all of this, there's a lot of emotions that are happening. The severe emotional distress when attempting to discard is very real. They often have a lack of awareness of the severity of their behavior. They don't realize how dangerous it's getting, how out of control it's getting, and they may feel angry, defensive, overwhelmed. All of those feelings will come about, including hopelessness, depression, guilt, shame. So we got a lot of emotions that are turning. I don't know if you guys have seen the show on A&E. I think there's multiple varieties, variations of it now, of the hoarding shows. What they do get right in those shows, if you watch, at the top of the hour, the person seems very motivated. Like, I'm ready, it's time, I know this is a problem, I want help. About 15, 20 minutes later, they're getting agitated. You're touching my stuff, this is not what we agreed on. You're doing stuff behind my back. You know, this isn't going the way I thought it would be going. Maybe another 10 minutes later, they're done. They're done. Get off my property. Don't touch my stuff. I'm done with this. This isn't what I signed up for. All of those emotions that occur, that's real. The show gets that right, 100%. They can go back and forth on their level of willingness to make change very rapidly. So you have to expect that and sort of anticipate those waves of emotion that go from, I really want to do this, to this is really not my problem. This is your problem. You're the one that has a problem with my stuff. And so that's really important to sort of understand that that's normal and to expect it. So when you're talking to someone who's struggling with these behaviors, it's really important to be respectful. And that seems logical. Of course, we're going to be respectful, but it can be very hard when you're working with someone who is talking to you in a very logical manner, but they're not listening to you. They're not hearing the words because they don't want to. So it's hard. It's harder than you guys know. It's hard to do, to be respectful of all times. You have to be non-judgmental in your words and your behavior. You can't make faces. You have to make sure that you appear on their side at all times. And you know that you are. It's just really important to keep that presence at all times. And use their language. If they call their items a collection, call it a collection. Even if you think it's junk or trash, it doesn't matter. Use their words, respect their belongings, value their belongings. Don't walk in and start touching their stuff. That will put them on edge pretty quickly. If you're going to touch something, ask them first, because remember that it all has value, equal value to them. Don't impose your feelings on them. Don't say, gosh, you would feel better if I could help you do this, or if we could clean this room, or if this would happen. Just, those are your feelings. Those are not their feelings, because they are not going to feel better. This is going to be a long, hard process for them, and it's going to take them time. Focus on the issues and not the underlying causes, especially when you're trying to work on people's behaviors. They'll really want to start diving into like why this is happening, why they're behaving this way. Maybe there's someone in their family. Maybe their parents went through the depression. Maybe they've had a horrific, traumatic childhood. They'll want to go into the causes. Try not to focus on the causes. Focus on the issues at hand. And because if you can keep the conversation centered, you might make a little bit more progress. Other thing is praise frequently and genuinely. Every little win, celebrate it and acknowledge how hard this is for them, because this is truly one of the harder things that they will ever do. So barriers to communications. So keep in mind that they might have different solutions. Maybe they would rather reorganize and not discard. They will be very frustrated because we don't understand how valuable their stuff is. And when they get that sense, those walls are going to come up right away. And ultimately, they're afraid that people are going to throw their stuff away behind their back. There's going to be a lot of mistrust. They've seen the shows too. So they're aware what family members and that what professionals can do behind their back. So they're very aware and afraid. I've had people talk about the shows in different ways. I've had some people say, oh, I watched the show because then I can say, oh, I'm not that bad. And I had someone else say, oh, I watched the show because I feel like it makes me feel like I'm not alone. It's nice to know that there's other people out there that are feeling the way that I'm feeling. So very, very, very interesting how they relate to the show. This is a public health issue, which a lot of people don't understand, including the people who are struggling with these behaviors, because it extends past the person. This goes far beyond. There can be a lot of agencies involved. There's high fire risk, of course. There's pest infestations. There's animal control issues. There's eviction issues. And there's the health issues that they can have. There's increased risks of fall, infection, respiratory problems, all sorts of things. The estimated costs for hoarding traditionally has been very hard to quantify, but the San Francisco Hoarding Task Force did a long-term study, and they have estimated their cost to their city to be over $6 million per year, which is an astounding number. And most people don't recognize that that is the cost that we spend. If you think of all the people that are involved, all the agencies that are involved, all the time that is involved, just working with one client, depending on their situation, the costs can be huge. It can be anywhere from $50,000 to $2,000 to $20,000 per client, with a mean of about $3,100 per client. You know, that adds up quickly. So I wanted to show you one of the assessment tools that I think is really helpful. It's the clutter image rating. You may have seen it before. There are a lot of assessment tools out there. So you can do any type of Google search and find a whole bunch of different kinds of assessment. Excuse me. But this one I like the best because it's photos. And I think photos are really helpful to get an accurate sense of what's going on, but they can also show improvement. And I think that's really critical, especially in this type of scenario. So this assessment tool was developed, and what they did was they rented an apartment and then they slowly filled the kitchen, the living room, and the bedroom with stuff. And they took pictures, 9 pictures of each area to sort of show you the gradual increase. And if you're working with a client that you haven't been in their home, you can show them the pictures and say, roughly, what does the inside of your home look like? You know, and you can gauge with what you're working with, you know, before you've even entered the home. So it's another reason that I like pictures. But you can see from picture 1, it looks good. Picture 2, you know, just a little bit of stuff out of place. Picture 3, we're getting into kind of maybe just a little bit more messy, but everything is still workable. It looks like you can still just reach the refrigerator and the stove and, you know, the sink, everything looks okay. I would say by the time you get to picture 4, because this was a question that Sarah and I discussed, is, you know, housekeeping. When is these situations out of housekeeping's role? I would say by the time you get to picture 4, we're past a housekeeper coming in. This is venturing into territory that is it's too much for a standard housekeeper. It's too much to ask. And more than likely, the person who lives in this dwelling is not going to want a housekeeper to come in and touch their stuff. So, but you can see that the items are beginning to build and get worse and worse. The pathways are getting to be cluttered. The stove and the sink possibly are inaccessible at this point. And then it just keeps going until they can't get to the kitchen at all. So, and that is what happens in these circumstances. These hoarding behaviors, they develop over time. When they start in adolescence, your behavior is somewhat curbed by your parents, and then your roommates, and then maybe your spouse or your family. But as you age, you've had a whole lifetime of these behaviors, and you stop listening to those social cues that you're getting from everyone else. And that's how we get to these situations. They will continue to deteriorate. They're never going to say, you know what, I'm good. I've got enough stuff now. I feel okay. I feel safe. I'm good. They're never going to say that. Until those behaviors change, they will continue to acquire stuff, and the situation will continue to deteriorate. So treatment. So again, always want to reiterate that hoarding disorder is a mental health issue. It's really important that everyone understand that. Counseling has to occur. There's a lot of stuff that has to go into changing behavior. And the overall goal is safety and improvement, not perfection. You're not going to get them to a place where you would feel comfortable. We need to get them to a place where they feel comfortable and they're safe. And again, forced cleanups are not recommended. Studies have shown time and time again, they're ridiculously expensive, up to $15,000, depending on the condition of the home. And if nothing is done to change the behaviors, within 6 to 8 months, you'll be right back where you started. So it's money that's just lost. So never recommend. One of the very popular treatments that can be successful is cognitive behavioral therapy, which really focuses on helping them create a different relationship with their possession. And it focuses on the behavior, organizing, sorting, discarding, decision-making. People who struggle with hoarding behaviors have some executive function deficits. And that is, our executive function skills are time management, decision-making, organizing, things that you kind of just take for granted. But someone who's struggling with hoarding behaviors really struggles with that. There's a deficit there. So they need help understanding how to organize, how to sort, how do I discard? How do I make the decision which shirt to discard versus which shirt to save? How do I make those? And how do I control my urges to acquire new possessions? So that's what therapy can really help with. It can help manage the illness and really help them prevent some relapse, because they can make big strides, but if something else in life sort of throws them off, they're going to go backwards. And if you think about it, that really applies to a lot of us. How many of us try to behave certain way? I look at dieting sort of like this. If you are dieting, how many do really good for a month or so, and then something happens and you're a little stressed and you revert to your old behaviors? The same kind of situation can happen with someone who's struggling with these behaviors. It's easy for them to get thrown off track. It's also important, I think, for people to remember that these behaviors have occurred for so long that getting through those walls that they have built up is a challenge. Not once has anyone in their entire life, said something positive to them about their items. No one has said, "Oh, I love what you've done to the place. This is great." No one says anything positive. So every time anyone brings up the conversation about their stuff, they know it's going to be a problem, and their walls come up right away. They don't want to talk about it. They know where this conversation is leading. They've been there 100 times before. And it's important for you to know that, because you can, with that knowledge, you can slowly start to build that trust relationship that's needed, and slowly help them get those walls down so you can have some real conversation. Another successful treatment has just been harm reduction strategy. When we talk about how they might have different solutions in mind, is harm reduction strategy can really help with that, because a lot of times if you start right in with, we have to get rid of, we have to do this, we have to throw this out, you have to discard, you have to, you have to make all these changes. It's overwhelming. And they're instantly just like, nope, I don't think I can do this. It's too much. And the harm reduction strategy is really helpful, because you're not talking right away about discarding. You're talking about reorganizing to make them safe. And that is really a critical difference. It can make them listen a little bit longer than maybe they normally would have, because this might be a different approach than anybody else has said to them. So you can talk about how, you're not safe. What if, and you can give them scenarios that can help them understand what that means. What if you fall and the firemen have to come in? They can't get in. What's going to happen then? It can help them see that what you're saying is really valuable, and can encourage them to make some of the changes of reorganizing. And once you get to the point where reorganizing is kind of working, and then you can start talking to them about discarding, because now you've built that trust relationship with them. You know them a little bit, and that can be helpful. You need to start small. You have to make realistic tasks. You can't say, okay, this weekend we're going to clean the living room, because you're not going to clean the living room in a weekend. You need it to be a small space, maybe half of the table in the living room, something that's small and realistic and achievable, so they can see their success and they can build off of it. It's baby steps. Baby steps will help them get the confidence that they need to move forward. And they need to feel supported and emotionally safe throughout the whole thing. Take photos. It can be really critical. It can be super helpful, not only for you to demonstrate progress, but for them to look back and say, look, I did this. I did this, I made these changes and I'm okay. I can continue to make more changes. So that can be helpful. And get creative, use visual reminders. I've had people talk about how, you know, if they're working in the kitchen and they want to make sure that they keep items, you know, within 2 feet of getting close to the stove, they'll use painter's tape and say, okay, you know, if you set something down, you can't set it down, you know, this close to the stove. A visual reminder like that can be really helpful. So you have to get creative. Talk to, and safety, talk to them if they have a pet, talk to them about, you know, how can we keep your pet safe? Which is different from animal herding. That's a whole nother issue. But if they have a pet that they love, you can sort of use that to help them focus on the safety aspect of their dwelling. And you can also talk to them about, you know, limiting the things that are coming into the house. Maybe reducing magazine subscriptions, not eliminating all of them, just reducing them, or reducing the number of times that they're allowed to purchase something each month. You know, not eliminating it, but reducing it. It's just, it can be a good starting point, a harm reduction strategy. Like I said before, it's really important to treat any underlying conditions. I always, when I'm talking to people who are family members particularly, I talk to them how important it is to get their loved one to the doctor just for a general physical. Let's find out what's going on, make sure everything's okay, and let's treat what is going on. If there's some depression, some anxiety, some attention deficit, you know, we've got medicine for that stuff. Let's get it for them. You know, anything that you can do that can kind of treat their whole being will really help them tackle these behaviors. You know, you can get them to the best they can be, so they're as ready as they can be to kind of tackle some of these behaviors. This stuff won't cure or prevent these behaviors, but it really will help. It kind of can give them a solid foundation to start with. And again, remember that no two hoarding situations are identical. It's a very unique interaction between the person and their environment and their background. And every case needs a unique plan. There's no formula to make this work. It's really time and empathy and patience. It's a lot of patience on your end. So progress, you know, why does progress take so long? And remember, it's built up over a lifetime. It's going to take people a long time to learn new strategies and develop new habits, because that's really what we're doing, is we're developing new habits and new thinking patterns. You know, you want to get them to a place where if they're in a store, and historically they would go through the store and they would just put stuff in their basket and then get to the point where they would check out. You want to get them to a point where either before they put it in the basket or before they check out, they look at everything, every single thing that they're buying, and they ask themselves some questions. Do I need this, or do I want this? Do I already have this? How many do I have? Why do I want this? And if you can get to them to the point where they can put even some of those things that they would have normally put in the cart and purchased, if you can get it to put it back on the shelf, that's a huge progress. You're restricting the amount of things that are coming into the home. And that's a big step. So very important. It's important to recognize that they know a lot of these, but developing the habit to have those new thinking patterns, it just takes time. Oftentimes they'll buy something and they haven't even left the parking lot before they start to feel anxiety about the items that they purchased, because they start to think, where am I going to put them? What am I going to do? So-and-so is going to be mad. And the anxiety will start to build already. So a lot of times this is not new information, but it's the habit building that's important to change the behaviors. So a community response. So what does communities do? So communities across the country are developing a hoarding disorder task force. And we developed one in Southern Arizona. I attend a lot of community meetings, and what I was recognizing was that clearly there was an issue. A lot of different agencies were dealing with this, but nobody really knew what everybody else did. They knew their piece of the pie, but they didn't know everybody else's piece of the pie. They didn't know what everybody else did. And so I thought it was important that we start something, mainly so the people like yourselves who are working with these clients knew where to reach out for help. Who is doing what in the community, so you know who to ask for help. And so we started a Southern Arizona Hoarding Task Force in 2012, just as an educational model, just to help the agencies figure out who's doing what. That's really where we started. And our meetings were really just entailed, everybody sort of having an opportunity to say, this is what we do. This is what we do. This is how we do it. This is how much we charge. And in 2015, we transitioned to a community action model where we actually started working with hoarding members. And we did a workshop, a 10-week workshop 2 times a year from 2015 until the pandemic. 1 night a week for an hour and a half. And it was open to anyone struggling with hoarding behaviors, not for clinicians, family members, or caregivers, only the people who are actually struggling with the behaviors. And we based it on a book and a program called Buried in Treasures, but we restructured the program for a larger class because we had a huge response. I go a little faster, I realize we're getting closer. The goals are clearly help them reduce acquiring, improve their discarding skills, and improve their decision-making skills. And we wanted them to learn new action skills and what the difference is between their new thinking skills and their new action skills and why that was important. We had homework and specific topics that we talked about each week. This is a picture of the book that I still highly recommend to anyone who's struggling with the behaviors and to family members of someone who's struggling with these behaviors. It's a great book. It's easy to read. There's exercises that people can do, but it's a great insight into what's going on in somebody's mind who's struggling with these behaviors. So I highly recommend it. Amazon has it. Has it gotten worse since the pandemic? There's been a lot of reports and media studies that have indicated that it is getting a little worse, that the people who are struggling with these behaviors are experiencing greater feelings of sadness and helplessness and general distress associated with the pandemic. And so you might have seen an increase in your area of cases and clients related to the pandemic. I think that's normal. If there's something stressful going on, I think a lot of us sort of resorted back to some bad behaviors. You could look at dieting again, and maybe we've all, eaten a little bit more. Stress does some strange things to you, and we all kind of resort to behaviors that we know can cause us some issues later on. But it's important to know that hoarding is chronic and lifelong. It goes way beyond emergency stockpiling or panic buying. So very, very different things. Particularly when it comes time to getting rid of those things. That's really the key. A hoarder is not going to be able to get rid of those things. Someone who's panic buying or stockpiling doesn't experience that distress when it comes time to give those items away. Okay, now we're ready for questions. Sarah, did you want me to stop sharing my screen or to leave my email up?
Why don't you leave your email up just in case people have questions and want to contact you. Thank you so much. This was so comprehensive for your expertise. I really appreciate it. Yeah, I would love for people to put questions in the chat, or they can also unmute and ask them as well.
And email me, seriously, at any point. I'm happy to, I may not know the answers, but I'm happy to brainstorm with you.
Great, thank you so much. Linda, I see your question in here about the hoarding task force that Lisa talked about. And is there one in Baltimore? I did just a quick just a Google search, honestly, on, what kind of resources are there for Maryland. And Maryland actually does have quite a few task forces in different counties for hoarding disability. So, hoarding disorder. So I will put those links in the chat and feel free to, look them over. We also have Wayforth, which I will put their information in the chat. They're one of our business members and can address this topic as well as the Abilities Network. So I'll put some resources in the chat that I know about, and then certainly I'll have them in the follow-up after our conversation today. Any other questions? Feel free to put them in the chat. Allison asked a question. Can you speak more about what a non-clinical staff person in affordable housing setting like maintenance or someone in security could do if they suspect a resident has a hoarding disorder?
I would say it would be important for them to tell the property ownership that there's an issue, especially in an environment like an apartment setting or something, because you want to make sure that the person is safe. There have been horrible stories where, we all worry about older adults falling and nobody recognizing that there's been an issue. That's really exemplified in a hoarding situation where they could get hurt and not be able to seek help. So safety first. We want to make sure that the person inside is safe. If you know they're safe, but yet you're still worried about the living conditions inside, there's a couple different ways that they can handle it. They can let property management know, really just so somebody can get in and kind of see what's going on. If it's a private home, you can call code enforcement. They're allowed to come out and look. They are allowed to look just on the outside of the dwelling to see if there's safety issues, if the hoarding has escaped the dwelling and it's now outside on the porch area or the driveway or in the backyard. They're not allowed to go in though, but from that, they can kind of gauge if something is going on. And if you're really worried about an individual, you can call Adult Protective Services. And they can go out and do a visit and see if the person involved is mentally competent. And if they are, that's pretty much where Adult Protective Services has to stop. We are allowed to live any way that we want when we're adults. We're allowed to make, good and bad decisions. And if you're mentally competent, Adult Protective Services can't go any further. But if there is some competency issues, then they have some of the resources that they might be able to access. Does that answer your question?
That's great, Lisa.
Sarah?
Thank you so much. Yeah, Marcy, go ahead.
So my question, first of all, thank you for all the great information. I learned a lot and a lot of new ideas. I think part of the issue is that initial conversation. And nobody really knows how to start that. It's like, you don't want to go in and say, oh my God,
right.
This is horrible. You can't do this. You're killing yourself and your pet. So can you just touch on how you would have that initial conversation in a more constructive, kind of caring manner? It seems like we just lack the words, because when you go in, you're in such a state of shock.
Right.
And you're just like, oh.
Right. Which is normal. I mean, it can be really shocking. So, when I talked before about really they're watching you closely. So really watch your facial expressions. You remember that they've never had a positive conversation with anyone in their whole life about their possessions. So they're already on guard and mistrusting you before you've even said anything. You can be there with the very best of intentions, but if they see even a glimmer of disgust or something go across your face, they're going to push you even farther away. So really try to watch your mannerisms, and don't touch their stuff is another big thing. Walk in, keep your hands to yourself, and don't talk about making drastic changes. They've heard all of that. So I would suggest starting the conversation with, a normal conversation. Like if you were just going to visit anybody else, how would you start that conversation? How are you today? What's going on in your life? What do you want to talk about today? Or this is why I'm here. You can be very upfront and say, this is why I'm here. There's been a report. Stay focused on the issue at hand. So try not to say, this is terrible. You're completely unsafe. We have to make all these drastic changes. Try to just focus on the one issue at hand. So this is the report that we've received. And let's you and I brainstorm some things that we can do to make this situation better. Make them part of the solution as much as you can. Expect the pushback, kind of be prepared for it, stay focused on the topic, because they got a lot of thoughts, a lot of creativity, a lot of things are happening, and they'll get off topic very quickly. So bring them back, focused. While you need to focus on the big picture, I would still recommend initially staying small. If the report is, we're worried about your safety because we can't, the entryways aren't clear. Let's just talk about that today. What can we do to make sure that your walkways are open and clear? Let's talk about that. Let's brainstorm some solutions. What do you think? And then you can slowly start to interject some ideas. But if you walk in and say, code enforcement's been here, the fire department's been here, there's some safety issues, you might have to be evicted. Like, these are all the bad things that are going to happen if you don't make these changes. I wouldn't start out that way. I mean, I've had several people, they're evicted all the time, and it's a horrible thing. And they know it's coming. So if you can take another approach that just sort of includes them in on the conversation, includes them in on the solutions, and see if you can come to some sort of compromise. If you give them tasks, make them small and realistic. They're not going to make big changes overnight. So be small and realistic. That will help them. And every step forward that you make with them builds that trust. And then you'll really, over time, be able to get to, the deeper dive, helping them to stop bringing things in, and then helping them make decisions on how to discard. Because there's a lot of decisions that go into how to discard, and teaching them how to discard, teaching them with the thought process of, do I need it? Do I want it? How many do I have? Those types of things can all be really helpful.
Lisa, thank you so much for that firm yet compassionate response. Really helpful. And I know in your presentation, you talked about therapy and, encouraging that some residents may need a next step of working through this with a therapist. And so do you have any further advice on encouraging someone to seek therapy who may be struggling with hoarding?
A lot of people that I have worked with are pretty open to therapy, actually. The problem is affording it. Finding it and affording it are really their biggest barriers. But many of the people are pretty open to it. It's not like they don't know they have a problem. The people that are struggling with these behaviors, they recognize that they're living, outside of the norm. They know it. They've been told it their whole life. And many of them are open to therapy, but there aren't a lot of therapists out there that are really familiar with hoarding disorder and the behaviors. And it's important that they find someone that understands what they're going through. So it's a challenge on your end, because you're not going to find a lot of people in your area that really have some expertise. But if you do, make sure that those are the people that you refer them to. Because that can be really helpful to not only getting them in therapy, but keeping them in therapy, so they continue to go back and get that support. And it's in therapy that they can do that deep dive, like, why is this happening to me? Why am I different? Why can't I live the way that my sister lives? Why can't I make the same decisions? Why do I need all this stuff? That's where they can do that deep dive and try to figure some of that stuff out. Your job is to help them make their current situation livable and safe. And so the therapist is a different approach, but you need both to have a successful behavior change and for them to live a safe and happy life.
Thanks, Lisa. That makes a lot of sense. Any other questions from anybody? There's none in the chat, but would love to have anybody unmute if they're able.
I would say, just while we're waiting for another question, what would be really important, and hopefully some of your hoarding task forces have done it, is to really create a resource list for agencies, for people like yourselves. Really, who is doing what in your area? Who is doing the counseling? Who knows about hoarding disorder? Who's talking to these people? Who are people that you can reach out to? Who can do the cleaning if that's needed? Who's doing that? And what does that mean? And how much does it cost? Who are the animal rescue groups in your area? And what experience do they have with hoarding? And can they be helped if you have a situation where they need to be pulled in? So a resource list can be very helpful.
Absolutely. Have you also found that hoarders can be reclusive as well? Can you talk a bit about that?
They're definitely reclusive because, one, they don't want anybody in their home. That's when they're found out is, and I've talked to family members where they're like, we didn't realize that Aunt Shirley had this problem, and we didn't realize that, she's really kept people out of her home for the last 10 years. We've always just met her someplace. They know that they're living differently. It's not a secret. They know it, and they don't want to hear about it. So they often will become more and more isolated over time. And just, they get tired of it being the topic of conversations, and they don't want people to find out. I have had participants who, one woman, professional, wonderful woman, high income, high education level, didn't have warm hot water for hot showers or cleanings for 2 months because she didn't want anyone to come into her apartment. So they'll let their situations get worse and worse because they don't want to be found out. They don't want to have those conversations again, because they doubt that they can change. And our job is to tell them that they can change. One, they're not alone and they can change. There are things that we can teach them that can help them make small but steady changes.
So one of the things I think you said in the very beginning that I wrote down because it was pretty eye-opening to me. I just hadn't even considered the thoughts around fear that people may have. I think you mentioned, fear of putting things away and then they can't see them. For those residents who have cognitive decline, forgetting, if I put this away, I might forget where it is because I can't see it. It's behind, it's in a drawer, it's in a wardrobe somewhere. So any thoughts or kind of advice you could give to those folks that the resident may just be struggling with fear of, I'm not going to be able to find this again if I put this away?
It really stems from the fear of making the wrong decision as well. There's a lot of fear that comes into play here, but the fear of putting things away can be huge for some people with this disorder. Not all people with hoarding behaviors will have the fear of, if I put it away, I'll forget. Because many people that you'll work with that struggle with these behaviors will say, I know where this is, it's 25 pages deep in that third pile over to the left, and I know where it is, so don't touch my stuff because I'll be able to find it. But there are others who won't put anything in drawers or closets simply because they are afraid that if they don't see it, they'll forget about it. And that's a real fear. And again, it just takes time. You just have to work with them. And if you can improve their decision-making skills on how to organize, what makes the most sense, and then give them small tasks where they can see some small achievements, it builds their confidence, and then you can just slowly build. This is just one condition where you're not going to make big strides quickly. It took them a long time to get where they are, and it's going to take a long time to get out of it. And I often relate it to, although physical addiction and mental illness are very different, but I relate it to people who are struggling with alcoholism. They're never cured. They have to deal with it and struggle with it every day, but they do. They have learned the skills to help them get through every day. And so people with hoarding disorder can do the same thing, but it's helpful for family members to sort of think of it in that light. We've had so much education on addiction that we know now we wouldn't just say, oh, Sarah, know what the problem is, why things aren't going your way, just stop drinking. That's the answer. Just stop drinking. You wouldn't say that to somebody because we've all had so much education. We know that's not how it works. It's very similar with hoarding disorder. You can't just say to somebody, just stop. This is the solution. This is what you need to do. Just stop bringing stuff in or just throw things out. Why can't you do this? It's the same kind of thing. We can help you understand. We just haven't had the education universally for everybody to understand that that's just not how it works. It would be great if it did, but that's just not how it works. They have to start slow, and they need help every step of the way to make progress.
Absolutely. I know, Catherine, I know you raised your hand. Do you want to unmute?
Sure. Thank you. This was a
Sure.
wonderful presentation and a hot topic at our properties at Fellowship Square. Overseeing the service coordinators, we're faced with residents who we suspect they do have hoarding issues. However, because it's a mental disorder, we try to be careful with labeling a resident. So I guess my question is, doing maintenance checks, and we see a resident has the bathroom piled high, full of clothes, kitchen items. Again, as a service coordinator, what's the first step? Is it true that we can't say, yeah, Mr. Smith, you're a hoarder, let's try to get you help? We're just trying to figure out, for the service coordination, the non-clinical side, how we could address a resident who we think they have issues.
That is a great question. And you're absolutely right. They don't like labels. You don't want to say to somebody, oh, you're a hoarder. Even though they may say, well, I'm a hoarder. It's not okay to go the other way. So I always use the phrase someone struggling with hoarding behavior, because then they don't feel that they're labeled, because it's a little more closer to the truth. They are someone who's struggling with these behaviors, but it doesn't necessarily mean that they're a hoarder. And all of them will feel very differently. So again, it's very unique, but most do not like the label. Although be careful, because they will call themselves a hoarder, but again. So, and if you're working with someone who has a specific need, a specific safety need that you have to address, like getting into the bathroom, that's where I would start. I wouldn't start with, oh, you're a hoarder, we've got this issue. Again, kind of looking larger picture, focus. We have to get in here to make sure that the water's running. You have to be able to use the bathroom and take a shower. This is for your safety. What can we do to make this happen? We want to make sure that you're safe, that you can live here and you're safe. So you're not talking about eviction. You're not talking about making radical changes. You're just talking about what can we do with you to get this situation resolved, and brainstorm with them some solutions. And in that type of case, I probably wouldn't talk about discarding. I would talk about reorganizing. What can we do to clear the walkway so the maintenance people can come in and make these changes so you can use the bathroom and use the sink and take a shower, because you can't stay healthy if you can't use those things. And we don't want it to get any worse. We don't want bad things to happen. So let's brainstorm. What can we do today to make this one issue go away? And then you slowly build. But again, don't touch their stuff. Don't label them right away. I think that's a great question. I have forgotten about that because they really don't like that. And just be kind and patient, just like you would be with any other tenant. And if you notice that you have several tenants that are struggling with these behaviors, you might want to consider having a little support group. Because one of the big successes that we had in our work group, really, more than anything else that I said, was just sitting in a room where they could talk to someone and they would say something and 10 other heads would go, yeah, I know what you're talking about. It can be really rewarding for them to have that camaraderie, because they just haven't had that before. So if that's something that you're interested in, you can reach out to me and I can talk to you about how you can run those little groups. I certainly didn't have any training when I started. I learned as I went along. And you can too. It's really just about following that book, Buried in Treasures, and giving them an opportunity to stay focused, but to help them learn some new skills, some new thinking skills and behavior skills. So just a thought.
Yeah, and thank you, Jamie and Sarah, for your comments in the chat. For Catherine, thank you so much. And Lisa, thank you so much for presenting this topic to us today, for your expertise. Some really helpful and practical advice I hope that you received today. Again, please feel free to contact Lisa with questions that you have. I love the idea of that support group. I think that would be wonderful. I know that we can talk about this topic and share all of our stories for the next hour or the rest of the morning. But Lisa, I want to respect your time. I know you have another engagement to go to. So thank you so much for your time with us today. We will be, again, sharing these slides after the call and also the recording, so that you can kind of do a deep dive with your teams when you get back with them. So again, Lisa, thank you so much. And I hope that everybody has a great rest of the day.
Thank you.